7:30, so we could start on time. First of all, I just want to say thank you so much for everyone for coming tonight. I see a lot of familiar faces from all throughout the application cycle, but also for the BCRP, both residents, both leaderships, all coming out to talk about this night, which is just so exciting. Honestly, this advocacy spotlight night was one of my favorites when I applied, and I think year after year, people find it just really cool to see all the different aspects of advocacy we have throughout the BCRP, both within the institution built in, but then also just like amazing things that residents and faculty are doing with the support of the institution. So hopefully, y'all tonight could get a little bit of a taste of that, and we'll go from there.
Awesome, guys. So first, just for some quick housekeeping, we'd like you all to just go and rename yourselves as listed here. So for the residents and faculties, if you could add your PGY year or faculty position after the R, the F in your name, so that applicants can identify who you are, that would be great.
Sorry, I couldn't unmute for a second. Okay, awesome. And here's our game plan for the evening. So we'll start with some introductions. We're super excited and so thankful for you all being here. And we're really happy that we get to share these advocacy opportunities with you. The goal of this session is really just to showcase how there's amazing work being done across the BCRP and at the different hospitals we work in, and to allow you to imagine how you could fit into that, the different ways that you might like to continue your advocacy experiences while in residency yourself. We're super lucky to attract so many applicants who are leaders in this space and really hope to continue this work. And we're really excited that we get to offer that in residency. And so to get started, we'll start with some quick introductions. First, a quick hello from our Diversity Council co-chairs. Dr. British Fields has been a huge part of planning this. She's not with us tonight because she's doing something very, very fun with her family. But I wanted to make sure that we gave her a shout out because of all her hard work, as well as Mike and myself, who will introduce ourselves in just a moment. But I would love, Toby, if you can give yourself a quick introduction so everybody knows who you are for all of your hard work.
Hi everyone, we're so excited to have you guys join us tonight. I'm Toby. I'm one of the second year triple board residents, and I'm very excited. Welcome.
Awesome. And now we'll introduce ourselves as the Rising Chiefs who are on for the evening. We are the Rising Chiefs, which means we would be your Chiefs next year if you're joining us for intern year, which is super exciting. You may have met us on interview day or at happy hours, or if you haven't yet, you certainly will. But we'll give ourselves a quick introduction and then get the night going. So I'm Eleni. I use she, her pronouns, and I will be one of the Rising Chiefs over at the Boston Children's Hospital.
And I'm Abby, also one of the Rising Chiefs. I use she, her pronouns, and I will be on the BMC side.
Hi, everyone. I'm Hannah. I use she, her pronouns, and I am one of the Rising Chiefs over on the BMC side. Nice to meet y'all.
My name is Mike. I use he, him pronouns. I'm one of the lead rising chiefs, and I'm on the BMC side.
And I'm Ben. I use he, him pronouns, and I'm going to be one of the chiefs on the BCH side. And so next, I want to introduce Wendy Chung, who is our chair of pediatrics, who is going to talk a little bit about some of her work in advocacy and research and leadership.
Hey, Ben, thanks. I'm thrilled to be here with you tonight. I'm Wendy. I am a geneticist by training, and in doing this, I've tried to be able to instill what we do with advocacy, not just with what I do in my leadership role, but even in my research and my clinical care. And so as an example of that, I think it's really important that we find ways of being able to reach all children and do it equitably and try and do it through a public health lens. And so as someone who's been working on newborn screening for a long time, that's actually one of my passions. So I'm working on ways of being able to start out with every child starting the healthiest life they can by having us be able to read out the relevant genetic information for actionable information so that we leave no one behind. And I'm thrilled that this last week, our paper that was published in JAMA earlier this year was highlighted as one of the top 10 papers of the year. So thrilled that we're having an impact. And as we're doing this, we really think about doing this for the public health and being able to do it eventually for every baby, not only here in the United States, but even around the world. So with doing that, we hope what we do for one, we do for all. So, and that's really the spirit of what we do here. We use our hearts and our heads to be able to help all kids. So thanks for having me tonight. Looking forward to meeting you.
And with that, we'd love to turn it over to some other leadership roles within our institution, specifically within the program. We'd love to pass it off next to our fearless leaders, Ted and Chris.
Thanks, Mike. I was wondering whether we should put Wendy on the spot and have her answer one of our recent icebreakers. What do we think? Wendy, you up for it? Okay.
Absolutely.
Okay. So the question, one of the most recent questions was if you were going to have a pet that you wouldn't typically find in a pet store, what would it be and why?
Oh. This is kind of corny, so it'd be a koala bear. So a koala, because one of our studies is actually named Koala, and it's about that's our mascot for our lab, actually. So, and there, I actually went to Australia. I can't pull it up quickly, but I've got an adorable picture of me and a koala in Australia, and they're just fuzzy and warm and adorable. And anyway, they're cute.
Fantastic answer. Not corny at all. Very pertinent. And congratulations on your paper. That's remarkable. Hi, guys. I've met a lot of you already at our first half of the interview season. I'm Chris Cheston. I'm the Boston Medical Center based program director and partners with Ted over at Boston Children's Hospital. I'll just share a little bit of my advocacy journey. I came to the Boston Combined program as a UHAT then, now it is lead resident, thinking global health was going to be a big part of my career, but very quickly realized that the care we were providing to patients and kids who prefer languages other than English wasn't quite where I thought it should be. And so really shifted my interest and passion, learned a little bit about QI, and have focused on that for a lot of my career with a lot of intersection too with medical education, preparing residents to become approved bilingual providers, and making sure that we're providing our patients with the absolute best communication possible. So that's one of many of my advocacy interests. And I just want to focus again, some of you guys have heard me speak about this at interview day, but just reemphasize how core of a part of our identity and our value as a leadership and as a residency program and institutions advocacy is. Whether you're a basic scientist like Wendy and many of you on this call right now who use your superpowers in the lab to identify new therapies and new approaches to care for vulnerable populations, or whether you are advocating for increased funding for understudied diseases and pathology, etc., to the folks on this call who are grassroots organizers who are marching to the State House, right, telling our legislators what needs to happen on behalf of child health. I think it's one of the biggest myths about our program that perhaps some folks come to our interview day thinking, oh, the BCRP is just for researchers, or the BCRP is just for medical educators. Yes, we love people who have those special tools, but really we see advocacy as cross-cutting every one of those additional tools for change, we call them, in BCRP. And so we really care about that, both in fostering a diverse class and in thinking about the core principles that our applicants care a lot about. I will just say I'm really excited to highlight, too, the fact that we have great support across all of our institutions. BMC, BU, Harvard, and Boston Children's all have immense resources in terms of advocacy. You're going to hear about some of that in this presentation, but want to emphasize sort of how much of a strength I think and value this is. I'll pass it over to Ted to introduce himself and share more about himself as an advocate.
Thanks very much, Chris. I'm Ted Sektish. I'm Chris's partner program director based at Boston Children's Hospital. And the advocacy that I've done in my past has been related to several leadership roles that I had. I was the executive director of the Federation of Pediatric Organizations. And in that role, we really worked together with Bruder Stapleton and Dick Bierman to move all of the fellowship program match dates to the senior year. They used to be scattered throughout the junior year, and it wasn't very well coordinated. And in order to do that, we founded the Council of Pediatric Subspecialties to be a place where fellowship directors could come together, as well as representatives from the various subspecialties. The other thing that I did as president of the Association of Pediatric Program Directors was to lobby both Congress for continuation of GME funding and the ACGME related to many of the different changes that they were trying to impose on pediatric residency programs. So again, most of my advocacy has been related to residency training, fellowship training, and all of graduate medical education. It's exciting to be here today, and we're going to share more with you about how we think advocacy is featured in this program today.
Amazing. Thank you so much, Chris and Ted, for introducing yourselves and sharing all of that with us. Next, we're lucky enough to have some additional members of our faculty and leadership here on the call. So if I could ask you to each take a moment to introduce yourself, you can share your name, your pronouns, your role, and your personal interests in advocacy.
Hi, everyone. I'm Destiny Tolliver. I'm a primary care pediatrician and health services researcher at Boston Medical Center, in addition to my role as the Associate Program Director for Climate and Community in the BCRP. My research focuses on kids and families impacted by the criminal legal system, with a focus of thinking about what policies may improve outcomes for them. And so my advocacy journey includes a lot of things like giving testimony, working with some community organizations on their advocacy. And I'd like to just throw in the plug that a lot of this work started with some internal grants that I got during residency, and that really gave me some of the tools to get me to this role. Now I'll pass it to Caitlin, I believe, is on the call as well.
Yeah, thanks, Destiny. Hey, everybody. My name's Caitlin Blackburn. I use she, her pronouns. I'm an adolescent medicine physician at Boston Medical Center and the lead track director for the BCRP. I'm going to tell you all about my advocacy interests in adolescent medicine and healthy relationships shortly. And so with that, I will quickly pass the baton over to AJ.
Good evening, everybody. My name's AJ. I'm Anthony in all the systems. I'm a primary care doctor here at Boston Medical Center. I'm also one of the population health leaders. For your purposes today, I'm here in my role as the lead curriculum director. I'll talk to you more about that later on, but some of my personal advocacy interests are sort of in the world of disability justice, and then also a lot of how we design the sort of like payer-payee relationship. So how do we incentivize the health system to actually improve outcomes and decrease inequities? And it's just nice to see a picture of all of my friends up here on the slide. So I'll pass it over to Mark.
Thanks so much, AJ. My name is Mark Kester. I'm one of the APDs on the Boston Medical Center side, and I'm a neonatologist by trade. I use he, him pronouns. And I think my own personal advocacy interests, I think the one that rises to the top for me is language concordant care. I think that's something that's really important to me and something that I'm really grateful to have a chance to work at a place like Boston Medical Center that really prides itself in that. And I think our entire program as a whole is really focused on that too. And I also have a chance to work with the residents on the Health Equity Rounds series as one of the faculty mentors, which I'm really grateful to work with Heather Shue on that. So I guess on that note, I'll pass it over to Heather.
Thanks, Mark. So I'm Heather Shue. I use she, her pronouns. I'm a pediatric hospitalist at Boston Medical Center, and I'm here in my capacity as the lead faculty mentor for the Health Equity Rounds program. And so actually both AJ and Mark are also faculty mentors for that program. I'm also a health services researcher, and I do research that focuses on advancing the quality and equity and efficiency of healthcare delivery, particularly within the safety net. And so my research is in service to safety net populations more broadly, and children in particular, particularly children and families who are affected by parents who use substances. And so I think I'll leave it at that.
Awesome. Thanks so much, guys. And just like looking at this lineup for tonight, applicants, you guys are so blessed with how many brilliant minds you have on the call with you tonight. And I'm so excited for you to hear more from them about their work and what they do and what advocacy in the BCRP looks like. So we'll just jump right into it. And so I'll hand it over to Destiny to talk more about the landscape of advocacy in Boston.
Awesome. Thanks, Abby. So for all of you to know, we are very fortunate to be in Boston for many reasons. One being that it's the state capital of Massachusetts, which gives the residents the opportunity to really easily engage in legislative advocacy. The Massachusetts State House, which is shown on this map in the yellow star, is easily accessible, just a short T ride away. It's right by the Boston Common, and it's really close to both of our hospitals, which are shown in the Blue Star and the Red Star. Um, and so it's been really nice to be able to spend a lot of time there to get to do some advocacy, legislative advocacy in that area. In addition, Boston itself has a wealth of advocacy and equity related resources from several academic and public health institutions to a strong and innovative public health department, both the Boston Public Health Commission and the State Department of Public Health. Not to mention our public health insurance, which AJ was talking a bit before about the payer payee work. And they're doing some really innovative work there as well. And there's also just a breadth and depth of innovative and longstanding community organizations all throughout the city and all throughout this kind of metro area around Boston. As a progressive city and a progressive state, Boston, Massachusetts are often at the leading edge of initiatives related to mitigating inequities across the spectrum related to child health and beyond. So it's been a really great place to work. Okay, and so the landscape of advocacy and equity work in the BCRP is broad and deep, and across several domains, residents and faculty work to address the pressing challenges that face our communities, clinics, city, and nation. And so tonight we're going to highlight 7 of those domains through the lens of resident and faculty voices and work. And I think similar to what Chris Cheston was saying earlier, this isn't really considered extracurricular. Advocacy and equity work really is robustly fostered throughout the residency. Conducted within our institutions at Boston Medical Center and Boston Children's Hospital, both of which have active offices of government affairs and community engagement programs. Championed by, our advocacy is also championed by our resident leaders in professional organizations like the AAP. It's strongly incorporated into resident and faculty education. It's supported as a form of scholarship in various journals, as well as actually outreach to the media. Many of our residents and faculty have had articles published in the Boston Globe or in various other media outlets. We also work with community members and organizations. And again, we've taken a lot of this advocacy to our state capitol right here in Boston through our legislative advocacy efforts. And so I'm going to pass it to the rest of our speakers so that we can talk about how each of those domains kind of play out on a day-to-day basis.
Yeah, so this brings us to our section on the spotlights, where we're going to highlight some specific work that's happening here. We hope that by hearing from a few of our residents and alumni, you can really try to get a better understanding of the advocacy that happens here. So first, I'm going to introduce Harris. They're an amazing intern in the BCRP, whose projects are touching on all forms of advocacy, but most specifically on LGBTQ advocacy. Harris, you want to take it away?
Yeah. So hi everybody. I just wanted to talk, I guess, about how the BCRP has supported the work that I've been doing with LGBTQ health and gender-affirming care in the field of pediatrics. I have over-engineered these slides, so there's a lot of like animation stuff to click through. So if we could just click the next. The first thing I want to highlight is that this is one of the main benefits of a combined program, and that's that we have the opportunity to rotate through multiple clinical sites. And those include, for gender-affirming care specifically, the Center for Gender Health at Boston Children's, and the Catch Clinic over at Boston Medical Center. And also just to highlight that our primary care and adolescent clinics at both these sites also provide care for trans and gender diverse patients. And I think it's also worth noting that in this current landscape, it's actually quite remarkable that we have access to 2 sites that are still providing this care to pediatric patients. And that the program and the hospital as a whole has made it part of our mission to continue providing this care as long as possible. And one of the main benefits, I think, of having those sites is not only the training that we get by being able to rotate through those sites as part of our core rotations, but that gives us access to the training, but also to mentorship. And there are a lot of faculty here with the program, folks who are involved in clinical work in the gender-affirming care space and LGBTQ health, that if you tell them that is something you're interested in, they will jump at the opportunity to mentor you and involve you in on projects, which has been something I've been able to get involved with. Another benefit is that this program is very engaged with the community, and I'll highlight some of the things later, but there's events like Pride and various community organizations that we have close contacts as an institution, and also on like a personal level with multiple of our residents who have done work with some of those organizations that I'll shout out at the end. And just the last thing to highlight, I guess, is that I've really been able to use research and scholarship as a form of advocacy. I think it's so important to to continue doing research in these spaces as like funding is being cut, as focus is being pulled away from this already really marginalized community. I've had mentors here within the BCRP at Boston Children's and BMC who have been very dedicated still to using the existing scholarship for review papers to guide care and to help generate new knowledge in the space where new research isn't really being done and training isn't happening in a lot of programs across the country. And also using the clinical data that we already collect at these centers that are still providing care to then guide future care and using that as a form of advocacy as guided by our community allies and the needs of our communities that we work with. I included some photos. So this is just a photo of us at Boston Pride. We march as a program every year. It's a really great way for us to show out for the community, to say that that we're here and that we stand with our LGBTQ and trans patients, families, and community members. And it was like such an awesome way to get connected with resident, I guess like mentors in the second and third year of our residency class. And then next little thing, I just like, it feels weird to like humble brag, but these are papers that I've been able to work with faculty members here already. Both of these are just review papers that we were looking to just, I guess, better guide the care that we're doing in the gender affirming care space. One was from med school. We finished up here at my intern year, and this other one is looking at best practices for gynecology providers and pediatricians to best support trans patients in clinical spaces. And so our goal, I guess, is to use that research as a form of advocating for our patients and to also educate trainees and people who are providing care for these patient populations. And lastly, I just want to highlight some community organizations that as an institution we have ties to and also individual residents have worked with. One is Bagley here in Boston, Trans Resistance, who organizes a lot of events here that we've shown out for, PFLAG Greater Boston and Boston Pride for the people who organize Pride every year. Just to say that we are very tied into the community, and that's a very important source of guidance for the work that we're doing. And as a program, I feel I've had really good mentorship that has guided me towards working with those community members.
Amazing. Thank you so much, Harris, and such a well-deserved humble brag. That is insanely impressive and productive for not even halfway through intern year. And moving right along in our spotlights, next I'd like to introduce Dr. Hayden Hatch, a second-year resident in the child neurology tract, whose advocacy focuses on patients affected by limb loss and limb differences globally. Take it away, Hayden.
Thanks. Thank you so much for that introduction. I'm in the child neurology track, but this has nothing to do with child neurology. And I think this is a good example of even if you're not in lead, I'm in the categorical child neurology track or in the global health track, you can still be involved in advocacy efforts. You can click next. So a lot of this is the title of this is providing free prosthetic limbs and support to pediatric amputee patients in Zambia. And while there's a lot of data on causes of limb loss in the older population, there is, surprisingly very little data regarding causes of limb loss for the pediatric population, whether it's limb loss, limb differences, congenital or acquired. And you can click next. I was involved with this organization, the Limb-Kind Foundation, in medical school for a number of reasons. The first, probably because I myself am an amputee. And so I actually worked with this organization that is based out of Long Island. I grew up in New York City, and they are a prosthetist location, but they have a mentorship program as well. So throughout medical school, I mentored kids with congenital and acquired limb loss and limb difference. And I sort of extended this work into my residency. They travel around the world and provide free prosthetic limbs for children with limb loss and limb differences. And one of the locations that they went to during my intern year was actually Zambia. And I had the amazing opportunity to get to go with them. Next. The only issue is that I needed funds. And while there are several grants in the BCRP that you can apply to get funding for global health projects, the deadlines for those had passed. And so I was able to start a GoFundMe, and many of my co-interns actually donated to this trip. And I was able to go with the Limb-Kind Foundation to build prostheses for children there. Next. So here's just like a brief list. There are about 30 children here, and these are the causes of some of their limb losses and limb differences.
A bunch of these are congenital, and many children who live with limb loss and limb differences, it's due to a congenital reason. And so, there are a couple of snake bites here, but it was just a remarkable opportunity to get to go to Zambia. I did one of those takeover Tuesdays while in Zambia during my intern year, which was also a great opportunity, and I got to show many of the applicants, some of the work that we got to do. But here are a few photos. In the top row, it's me with a bunch of the kids there. We actually partnered with the Bite Cure Children's Hospital in Zambia, and I served. My primary role there was a mentor, but there were prosthetists as well as PTs and OTs, and this organization goes to these locations every single year to sort of make repairs on these prosthetic limbs as well. So Ethiopia, Zambia, Sri Lanka, there are a number of places they go to. And at the end of the week that I was there, we held a show called Show Your Shine, which is basically a runway event for these children at all these locations globally. But they also have their own Show Your Shine event every year based out of Long Island, which I'm actually going to go to this coming year as well. But it just, is an opportunity to sort of, allow the children to, be comfortable in their body and their new prosthetic limbs. And many of the children and their families, you can see at the bottom, enjoy this opportunity. So that was my advocacy project, which is part of the Keystone rotation, which is now, your advocacy rotation during your intern year. And you can get involved in advocacy work, even if you're not in the lead track or the global health track. So I think this is a really good example, and I wanted to share it.
Awesome, Hayden. Thanks so much. Could definitely feel your passion as you describe this. And I was able to watch that Takeover Tuesday, and so cool to see some of that work you're doing in real time. But next up, we'll love to pass it on to one of our faculty members, Dr. Caitlin Blackburn, who is our lead director, associate program director, and also one of my personal mentors. So Caitlin, would love to hear you talk a little bit about your advocacy.
Awesome. Thanks, Mike. As I shared before, I use she, her pronouns. I'm the lead track director for the BCRP and an adolescent medicine physician over here at BMC. At BMC, I provide adolescent primary care and subspecialty care. I run our menstrual disorders clinic. I run a low barrier walk-in birth control clinic, and I provide gender affirming care. I'm also a lead alum, and I stuck around at Boston Children's for fellowship in adolescent medicine and now get to work here at Boston Medical Center. And so very much so love this community. And I'm excited to tell you more about some of the ways in which I've built advocacy into my career and how the BCRP helped me do that. I have so many passions that I could talk about this evening, and I'd honestly be delighted to connect with anyone on this Zoom about any of them in the future related to adolescent medicine. But tonight in particular, I'm going to focus on my passion of promoting healthy relationships amongst adolescents. My passion from this topic really comes from growing up in a family where unhealthy and at times abusive relationships were the norm. But despite this environment, my mom's really incredible resilience instilled core values in me of love and empowerment, which have really just been my guiding stars in how I've gone about making choices and how I choose to spend my time, and ultimately shaping how I've built my career. And we can go to the next slide, Mike. Thank you. So my time to explore this interest more deeply really began in my advocacy rotation in the BCRP as an intern. I had done research previously in med school using motivational interviewing to help teens stop committing acts of dating violence against their dating partners, but the intervention didn't work. I really had minimal effect. And so it prompted me to do a deeper dive into the literature to better understand what could be done to prevent such violence from occurring in the first place. And so I used my time during the advocacy rotation in the BCRP as a jumping off point to learn more about what was being done in the city of Boston to help stop such violence from starting in the first place. And so while on my advocacy rotation as an intern, I had meetings with all different sorts of folks from national to local violence prevention organizations like Futures Without Violence. I met teen leaders at a program called Start Strong that's still actually going strong, who were then leading what was called the Breakup Summit, where they would host basically a big party to teach teens how to safely break up with somebody respectfully in a way that prioritized your personal safety. I mapped which schools in Boston had evidence-based curricula being presented to youth about building healthy relationships, which was like unfortunately very few. And where the gaps were, there were far too many. And really took every opportunity I could to teach my colleagues about the negative impacts of adolescent relationship abuse and how we needed to do better in supporting youth and gaining those skills. I did noon conferences on this. I talked about it at kind of every chance I got. And I let people know in the BCRP who I was. I let people in the community know that I was here and that I wanted to help and kept asking how I could help. And I showed up in whatever way I could. And from the opportunities that the BCRP gave me to share my passion about healthy relationship promotion, I ended up getting connected to my BCRP co-resident's wife to an organization called Respond, which is New England's oldest domestic violence prevention organization. This was the middle of the pandemic when I was in residency back in the day. And Respond desperately needed a physician support and understanding how to keep its services running, including a shelter for folks of all genders during the pandemic. And so they invited me in. I ended up liaisoning with the Boston Public Health Commission, and ultimately we were able to reopen shelter within 3 months of me starting to work with the organization, which was awesome. And from there, I was asked to join the board of directors at Respond. I've since helped expand their preventative programming to deliver evidence-based dating violence prevention curricula to several no schools in the area, kind of even expanding into the greater Boston area. I then liaisoned back with the Boston Public Health Commission and helped secure over $500,000 in grant funding to start a teen parenting program, which is now active and strong and serving youth who are parenting and fleeing violence by really helping them access services and, like, most importantly, housing. And I've educated the DV teams and the mental health teams at like our local hospitals about this resource to make sure that folks interacting with parenting youth know that this is something that's out there in the community. Um, and then from there, this like web of like groups that I've gotten to work with across Boston's gotten to grow and grow. I ended up advocating at the State House, both with Boston Children's Hospital's Office of Government Relations and like wearing my Respond board member hat for a piece of legislation called the Healthy Youth Act, which many of the residents and alumni and faculty on this call also advocated for, which was an act to update the healthy relationship and sex ed content provided to youth in Massachusetts, which ultimately, excitingly, got taken like out of the legislative session because we've got a great governor, and got instituted by the Department of Education here in Massachusetts. And like through the work with the Office of Government Relations at Boston Children's I got to do, I actually helped like craft the policy, which was just so incredible to get an opportunity to participate in that. And through kind of all that work, I ended up getting connected to folks working at another organization called One Love, which delivers healthy relationship workshops to youth kind of across the nation. I volunteered with them. I helped them kind of get their preparedness resources ready to support schools when there were publicized episodes of adolescent relationship abuse and to update their materials on teaching consent to youth. And then I was able to connect One Love to Respond, and now the organizations kind of share materials and best practices, which is incredible, to like actually deliver like evidence-based healthy relationship content to youth in the Boston area. I was able to connect like interested residents with One Love who wanted to learn more about community partnerships. And I'm currently working with the family planner in our clinic to bring One Love's teaching materials to the youth in our space through like anticipatory guidance that we're giving. And we're trying to create evening workshop that we're excited to hopefully start shortly. I've continued to foster these relationships with these groups and these orgs, and this web just keeps growing bigger and bigger, which is just so awesome to see. It's been like such a humbling and empowering journey to watch the way these partnerships have grown, kind of both me with them and them with each other. I've now gotten to help bring educational framework called Cues, that was championed by Futures Without Violence to various people about how to provide universal education on healthy relationships. Pediatric residents, the school-based health center, NPs, athletic coaches, family planners, public health practitioners, who in total we counted it up serve like over like 40K youth, which is just so cool. I've gotten to reach folks kind of everywhere from like local talks to national talks through the Injury Free Coalition for Kids, which is a coalition that was founded by Lois Lee, who works at Boston Children's in the emergency room, which is pretty cool. I've gotten to share this info at the Society of Adolescent Health and Medicine, organization where I co-lead our violence prevention committee, and I continue to do research on this topic as well. And so, as you can see, like my career is my passion, and my passion is my career, and partnership building is kind of at the core of this whole web. And I'm just forever going to be truly grateful for the way the BCRP set me up with like the time and the space and the mentorship to be able to really jumpstart partnership building so very early in my career as a physician. And the connections the BCRP community helped me build are just absolutely incredible. The BCRP community still shows up to me for me for kind of supporting this work in such special ways. Can you go to the next one, Mike? So in this in this picture, I've circled the back of the heads of a couple people on this call, including Chris Cheston. She's all the way to the left, and her husband, and then some people who like actually taught my like primary care continuity clinic back in the day. This is at the gala that I hosted for Respond last year. And all of these folks continue to show up and support me and the work that I do. And it's just so very special to be part of such an awesome community like this. And so with that, I'll pass it back to Eleni. Thanks so much.
Awesome. Caitlin, that is so incredible to hear. And I feel like every time I learn about it, I'm still amazed, even though I know exactly what's coming. It's like so incredible that you've done so much amazing work. All right, guys, so we'll move right along into learning more about our opportunities. And just as Caitlin had said, and I think Destiny mentioned too, a lot of our lead alum and resident projects and things that we've just talked about emerged from a lot of the built-in opportunities through the residency, such as health equity rounds or our protected time for advocacy. So we want to talk a little bit more about those opportunities. So specific things that we're going to touch on include the advocacy rotation, which we've kept in even though the new ACGME changes no longer require it. We have many opportunities for global health via our pathway and our academy. We have our lead track, which is a separate ERAS track from categorical that we'll talk a little bit about. We have a robust partnership with the AAP and an awesome resident group called Policy Think Tank that we'll talk about. We have some amazing medical education collaboration between faculty and residents for our health equity rounds, and our amazing diversity council, which hopefully you've heard about or come to some of our DivCo happy hours, but we'll talk a little bit more. And then finally, we'll talk about our program for language equity. So to get us started, we have Bree, who's a first-year lead resident with us tonight to discuss the advocacy rotation, which we maintained with these ACGME changes.
Hi, everyone. Hopefully you can hear me okay with my AirPods. We good? Yes, awesome. I'm Bria, use she, her pronouns. I'm an intern in the lead track. And since this is a newer experience with the ACGME changes, I think it'll be helpful to hear from an intern perspective, just how this has, been crafted and is continuing to evolve. So previously, you may have heard some folks mention the Keystone block, which incorporated many of these similar concepts that live in advocacy rotation now, but also incorporated adolescent and DBP, which are now separate rotations throughout your first year. But we still now have these two-week chunks of advocacy rotation. And as the slide shares, there's some flipped classroom learning. So some reading on various health equity advocacy topics. And then we come together and do learning in person. And many times that looks like having faculty that are doing awesome work come in and share, community organizations come in and share, or us going off site to other community partners. And so I'll just share some of my highlights from my advocacy rotation this summer. More than two. I have a couple highlights, but some like practical learning that I think was really helpful is we had a LARC training and gender care lecture. As someone who's interested in adolescent health, I think it was really helpful to have those concrete skills incorporated into our learning. And then some like other practical lectures we had were on government advocacy. So the Office of Government Affairs from BMC and BCH came and chatted with us, shared about the different like policy agendas of the different hospitals for the upcoming year. And then, laid out how we would be able to share stories and giving testimony for policies that would affect our patients. And then we got to watch our very own Katie Bick. There was a recording of her testimony for Cover All Kids. So that was like a very awesome, like from start to finish learning experience. And then thinking ahead of what policies will be coming through the State House this year. A couple other ones. There was a lecture from some social workers, both BMC and children's side, on patients experiencing unstable housing. And so that was super helpful in taking care of patients in the primary care setting, just better understanding what the shelter system looks like, and knowing like what the time restraints are for families in being able to be housed at various shelters. And so I wasn't asking redundant questions to social work and taking so much time during primary care. So lots of like practical learning that you could directly apply to your clinical experiences, and get more oriented to what supports exist for patients in Boston. And then someone mentioned Lois Lee. She gave a lecture on the policy landscape kind of at large. And then she is a expert in firearm injury prevention. And so as someone potentially interested in peds emergency medicine, I got connected with a potential research mentor. So there's so many ways that these various learnings can like directly impact your clinical experience, and then also connect you to mentors to advance your advocacy interests. And then we also had a ton of fun. Got to go to the rooftop garden and harvest some snap peas. Got to go to the YMCA, did a walking tour of Roxbury. So very well balanced rotation, and we got to plan lots of fun happy hours. I think I'm passing it off to someone for this slide, but I'm not sure.
Yes. So I think next up we have the Global Health Pathway and Academies, unless there was more to say about the advocacy rotation. I think we are lucky enough to have Dr. Natalie Nunez on the call. Are you able to join us from cardiology, Natalie?
Hello, everyone.
Awesome.
Awesome. So nice to meet everyone. Super excited to be here. So there are a lot of different ways to get involved in global health at the BCRP. I'll talk about these three. So first I'll talk about the Global Health Pathway, which is actually the one that I'm a part of. So 4 residents can be a part of this pathway per year, and you apply after match. So some things with this pathway is that we get embedded mentorship, which is really great. 2 of my global health mentors, Dr. Christiana Russ and Dr. Julia Herlihy, have been so amazing in connecting me with so many people that do the work that I'm interested in. And even if they don't have like a direct person that they know, they ask around and always find me somebody to connect with. So that's been great. There's also some dedicated curriculum to continue foster skills and research, clinical skills. We actually had like a global health ultrasound course last year, which was offered, which was great. And we just get a lot of opportunities to network and hear from people in the field. And then lastly, I think the biggest difference in the pathway is that we get protected time and funding for junior and senior year to do some global health work. And that was great. I did one in October, and I'll talk a little bit about it later. But in junior year, I got 4 weeks, and then next year I'll get 6 weeks, which is great. Next, the Global Health Academy, which is open to everyone. Here we get some dedicated afternoon sessions on a bunch of different topics. And there's also journal clubs, which are led by our own amazing residents. And then lastly, the Global Health Electives, which are also open to everyone. Our program has like established connections with partnerships in Rwanda, Tanzania, and South Dakota with the Indian Health Services, but I feel like our program is really willing to helping us get to wherever we would like to go and are passionate about. So the next slide, we have some pictures of our residents going on global health trips. I'll start with Sydney on the top left. She is a former BCRP chief and current ED fellow, and she was also part of the Global Health Pathway. Her work focuses on operation research on telehealth for critical care in India, and then also she spent some time in the Indian Health Services on a reservation in South Dakota. On the lower left, we have Win, who's a current chief and does med ed work in Barato, Rwanda. And then on the bottom right is Matt Nagy, who's a PGY3, also Global Health Pathway resident. And he's here in Burundi working on a project evaluating local interventions to improve maternal and child health. And then lastly, me, I'm on the top right. This is a picture of me during my global health trip in October. I got to go to Guatemala and work with the Mayan Health Alliance, which is an organization whose aim is to improve access to healthcare for their Mayan communities. I'm interested in NICU, so I was a part of an initiative on improving neonatal outcomes. And here I am with the newborn techs, who are members of the community, speak the Mayan language of Cachiquel, and are trained to do newborn visits, this is their way of kind of making that accessible to their communities. These women were such incredible advocates, and it was a privilege to work with them and learn from them. And I'm continuing to do work with this organization on making some practice guidelines for the techs on taking care of infants who are low birth weight, since there's a high prevalence of that in this community. So happy to talk more about my experiences, but we'll pass it on to Bree.
I'm back again. Hello. I'm just going to chat a little bit more about the Indigenous Health Program at Boston Children's, which falls in the Global Health Program. And so it's actually a program that's very special and growing. So basically in 2021, the Great Plains area Indian Health Service invited Boston Children's to come to Cheyenne River because there were a lot of challenges with physician vacancy rates, and particularly like a lack of pediatricians. And so since 2021, BCH faculty have been providing year-round clinical coverage. And then it has continued to grow, so then expanded to Pine Ridge, which is in the bottom here, and then Turtle Mountain, which is at the top. And so now there are 3 clinical sites that we partner with. And so this is an amazing opportunity for faculty, for medical students, resident rotators. But even more so, the clinical outcomes have been so awesome to learn about. And so already just at Cheyenne River, there's been increase in outpatient visits, increase in inpatient admissions, decreased ED transfers out of the community, and then improvements in various GIPRA measures, so like flu vaccines, fluoride administration, suppression screenings. So it's really elevating care for Indigenous youth, which is really a passion of mine and amazing to see and be a part of. And then, yeah, there's some additional community outreach efforts, including Bring, Reach Out, and Read, and then a new initiative to partner with schools and provide some adolescent health care in those settings. And I got involved with this program during my MPH during med school. And so these educational initiatives here that are nursing driven, but provided by BCH faculty on various pediatric topics, just because there was some limited reps and knowledge on pediatric care, because many of the kids would go to nearby children's hospitals, well, not nearby, far away children's hospitals for care. And so I did a monitoring and evaluation project regarding these pediatric clinical care curriculums for nurses, emergency medical service providers, and then advanced APPs, PAs and NPs. And so that was a really awesome experience. And this program has lots of opportunities for more community-centered research, and I'm excited to rotate there in my second and third years. And as Emma said in the chat, you don't have to be in the global health pathway to take advantage of these opportunities. And each of the sites kind of has a different flavor in terms of clinical experience. The Pine Ridge one will have more inpatient, whereas Cheyenne River has more of a primary care setting where you do ED consults and go to deliveries. So very, very awesome learning experience and a special community to get to care for.
Thank you guys both for sharing about your experiences and kind of how you've been able to engage in this work in residency. It's so cool and so inspiring. And I'm ready to pack my bags and leave on Friday with Faven to Cambodia. But we'll jump into the next part of the presentation where Dr. AJ Mel, who is our lead curriculum director, will talk to you guys a little bit more about the lead track and the lead curriculum and what that looks like.
Great. So thanks everybody for being here and spending your evening with us. And I'm excited to be here to talk to you more about the lead track and the lead curriculum. So the lead track is a component of the Boston Combined Residency Program, and it's really intended to develop leaders in equity and advocacy specifically. And to ensure that our trainees become those leaders, we ground the program in 3 principles. And so those principles are community, time, and support. So I'm a graduate of the program. I'm a BCRP and LEAD alum, and now one of the directors. And I can say that what makes LEAD so special really is the people. So it's a truly exceptional community. Each year we have 12 residents, including 1 BMC child neuro resident, And they are sort of self-selected by unified interests in becoming effective advocates for health equity. And they really bring with them an absolute breadth of experiences. And those united interests and truly diverse experiences serve as a real catalyst for growth and a great and really special community and space for our trainees. I like to describe it as like a current flowing down a river, right? Like we just keep having more and more incredible people, and they're creating these wonderful projects and advocacy and policy. And when you join as an intern, you're swept up in the current by the seniors. And when you're a senior, you leave a current for the intern. So there's this really wonderful current pulling people through. Um, the LEAD program also ensures that you get more time at our Safety Net Hospital BMC, where you're cohorted together on your advocacy rotation with other LEAD residents, have protected time to learn together for LEAD curricular afternoons, and protected group electives in your second and third year that you will sort of co-design as a group. So that's that second element. We know it's not just about the community, it's the other things that the institution provides. And so that's the time and then the support. And so finally, to grow into leaders, you also need the institutional support, which I really think is actually one of our biggest strengths here in the BCRP because of the nature of our program, it being a dual program between BCH and BMC. The lead trainees have their own dedicated program director, their own APDs, coaches, and an entire cultivated curriculum delivered 3 years designed just for them. And really, it's all centered on resident feedback and resident experience. You can go ahead to the next slide. So moving on to talk more about the curriculum, I want to start and with this quote, which I really think gets at the core of the curriculum's design, or at least like my maybe aspirational core for it. And it's a Paulo Freire quote from The Pedagogy of the Oppressed. And it's the idea that liberating education consists in acts of cognition, not transferals of information. So the curriculum's purpose is not to only deliver content, but to really equip our trainees with the ability to think critically about issues of health equity and give them the skills they need to succeed and be leaders in this space, right? So it's not just like teaching you about things, it's teaching you how to think about things. So to serve that purpose, we've developed a curriculum grounded in the application of health equity lenses or frameworks to different health equity topics. So you can see some of them on the right side of the slide here, or sorry, the left side of the slide, the racial caste system, groundwater approach, centering the margins, intersectionality, etc. And the intention of this curriculum is to prepare lead residents to be thought leaders in the world of health equity through the cultivation of historical context, theory-based learning, critical analysis, and importantly, solution design. In terms of design and logistics, the curriculum is delivered in curricular afternoons, which occur basically monthly and last for about 3 hours. And they are intended to be dialogical and heavily interactive. So I'm failing if I'm just talking to you or someone else is just talking to you. That being said, we do routinely bring in guest experts, alums, and community representatives to help facilitate the sessions. And these sessions are partnered with a 1 hour talk given by a senior resident on a topic of their choice called a RAP, or Research and Advocacy and Policy Talk, which serves as sort of like the senior capstone, giving an hour talk on something they know deeply and sort of evidence of their expertise that they can take with them. We also do have a web app that organizes the curriculum, so it's all up and available for you, so you can prep for the sessions easily. You can also reference material later, which really makes it like a very, I find that has actually been very helpful as the years have gone on. And finally, and I can't say this enough, accountability is at the center of this model. I am highly accountable to all of you as trainees in ensuring high quality, engaging sessions. And we are actively and constantly getting feedback, reimagining the curriculum, reimagining the sessions, and responding to what residents' interests are at sort of every single year. It's very exciting. It's something I'm very proud of. And I hope to see many of you in it. And now I'll pass it back, I think, back to Mike to talk more about the next things.
Awesome. Thanks, AJ. So I'm going to talk to you guys a little bit about the lead electives, which is 2 weeks of protected time for the lead cohort, both in second year and in third year. And I know I mentioned this a little bit on interview trail for some of y'all that already kind of rotated through with us, but just wanted to give you a little bit more details here and see what it actually looks like. Just as a reminder, this is truly our lead time to do whatever we think is most helpful to advocate for our community and to gain skills to advocate better in general. We literally met down with my cohort junior year over dinner with a laptop, and like this little chart is the product of that dinner, kind of deciding exactly what we want to do and where we want to meet and how we can best facilitate that. We decided we wanted to kind of group our whole weeks around LGBTQ plus health, and then we're like, okay, let's see some places in the community. We reached out to local organizations and scheduled some time with them. We wanted to learn more specifics on LGBTQ plus health and we got an expert from gender affirming care to come from Boston Children's Hospital and talk to us. And then we decided we also wanted some time to actually volunteer together in the community. And this is just a product of really piecing together what we thought would work best for us and really found that it was a fulfilling 2 weeks. You could go to the next click, please. Oh, JK. You can go to another click. Okay, no more clicks. I was going to show you a picture, but we were smiling. You could trust me. But just also wanted to shout out that even this next year, we're kind of going back to that same square and could plan whatever we want. So just another opportunity that's built in protected time to really advocate for our own skills and to make it what's best for us.
The next opportunity we want to talk about is our partnership with the American Academy of Pediatrics, or the AAP. So I'm super happy to introduce Maria, who's one of our second-year residents in the lead track. She's the AAP resident representative of the Massachusetts chapter, and I think also the assistant district representative for the section on pediatric trainees. So Maria, Toby, Emma, I think are all on this call, and some others who serve in the role of program representatives who help keep us in the BCRP up to date on what's going on in the AAP locally and nationally, and within the different sections that are relevant for pediatrics. So Maria, take it away.
Hi, everyone. Thanks for having me on this call. So yes, like Ben was saying, I'm the district representative for District 1. This is my second year being involved in the SOPT, the Section on Pediatric Trainees of the AAP. I started last year as an intern and get to do it this year as a second year. And it's also my second year as the resident representative of the Massachusetts chapter. So I've been able to kind of see how the AAP works from the state level and from the district level. And I'm really grateful to have had the opportunity to be a part of the AAP in Massachusetts, because Massachusetts AAP is one of the leaders nationally in the AAP, and District 1 is also like a big leader from the trainee and resident space as well, that's always doing advocacy and kind of leading the charge with initiatives on the state and national level. I think the first way that most residents can get involved with the AAP is to become the delegate for our chapter of the section of pediatric trainees within our program. So we have one representative every year, and our current delegate for SOPT is Emma Hartswig, who's a third year, who went with me to the AAP National Conference back in September, where we got to do a lot of networking and meet people across SOPT and across like AAP leadership roles and sections, and learn about the annual SOPT advocacy campaign, which this year is Mythbusters, Kids First, Facts Always, which we're all very excited about. Every year the SOPT has a advocacy campaign where all of the districts come together, and there's lots of events, webinars, and educational opportunities for residents and fellows and medical students as well to come together and do something to advocate for children in some way. And this year we're targeting misinformation, which is like a big theme of the AAP this year, given like everything that's been going on nationally, like for pediatrics. So that has been like really fantastic to be a part of. I'm participating in the advocacy campaign this year, and leading the delegates within District 1 to create like a couple of events for education of residents for as part of the advocacy campaign. So that's a way that anybody within the district can get involved, and residents, like even if you're not like in a leadership position in the AP, are welcome to be a part of. Other really great ways that we're involved with the AAP is through Catch Resident grants, which are available every single year. This is an AAP level grant that any resident can apply for to get funding for an advocacy project. So that's always an opportunity that is open to us. And your AAP reps can also connect you with mentors and facilitators that can help you be successful in applying for that grant. There are other grant opportunities to go to the conferences. There's two main conferences every year, the NCE, which is in the summer, and then there's an advocacy conference in the spring. We, in addition to the national AP, there's the Massachusetts chapter, which always has a resident representative, and they also have a legislative group that residents are invited to. And you can go learn about like what are the most recent legislative initiatives that the Massachusetts chapter is interested in supporting or promoting, and seeing how you can make an impact within the state for child health. And what else? Oh, and then like the other way that our residents are really involved is in resolution writing. So Abby Temple, for example, wrote and had a resolution published recently, which is really cool. And this is just like another great skill to learn as a resident, and a way that you can like impact child health on a national level. So lots of different ways to be involved in the AAP. We have a lot of alumni who have been in different tracks in the program, who have also been on the executive committee of the SOPT, and then have also become fellows within BCH and BMC, and like just continue to be involved, to be advocates in this way. So lots of opportunities to be involved there. Thank you. Oh, these are some fun pictures. Yeah. Oh yeah, RF Dash. Forgot about that. So
And I think Maria, Emma might even be on if Emma wanted to chat, but otherwise we would love to hear more from you. That was super helpful and informative.
Hey team, I am just talking super briefly about RF Dash, which stands for Resident Fellow Stay at the State House. The BCRP cannot claim RF Dash. It's actually planned by our colleagues at Mass General Hospital for Children. And I just think it's a really awesome example of collaboration across the different training programs in Massachusetts. So this is an annual advocacy day that our colleagues at MGH lead the planning for, but that the AAP reps, so like me for the third years, Toby for the second years, and Kay Elise for the interns, and then Maria as our AAP leader from a Massachusetts and regional standpoint, get to collaborate on. So every year, the planning starts in about January and involves selection of bills that we think are relevant to child health in Massachusetts, selecting speakers and building one-pagers to give for an advocacy day. And then the actual day itself is in June, where we spend the morning teaching participants about the bills and going over the primers and having a sort of a boot camp on legislative advocacy, and then getting to go do it in the afternoon with one-on-one and small group meetings with legislators and their staffers. And I've been involved in planning this since I was a med student, and one of my favorite things about it are just that it is a collaborative effort across multiple different training programs, that it is focused on child health and an opportunity to learn more from experts in the field in Massachusetts, and to directly apply skills that you learn same day. I think it's also an example of the fact that you don't have to have a large longitudinal and you don't have to start a nonprofit in residency is what I'm saying. You can do that's at you, Mike Taglianti. You can do good work and meet cool people and have an impact on just a single day a year, and also get to meet and learn from other people who are doing this in different programs. So those are some photos of us having fun at the days across the year.
Next, we have Dr. LaShonda Scarrett, who is one of our junior residents and also a rising chief resident. So would be a chief resident in your second year if you chose to come here to the BCRP. And she's here to talk more about the policy think tank.
Thank you so much, Julia. Hi, everyone. My name's LaShonda. I am a second year in the categorical track. I'm super excited to be able to share a little bit of information about our resident-led health policy interest group, the Policy Think Tank, which was really started by now program alum who basically recognized legislative advocacy skills as a really important development and competency building skill for us to have space to develop as part of our training as pediatricians. One of the things I really wanted to re-emphasize, which has been mentioned already, is that with the Massachusetts State House being located in Boston, it gives us, as trainees in the BCRP, a really unique and kind of special opportunity to hone our legislative advocacy skills at different levels. So at the local level, at the state level, And we have tons of discussions about kind of like global health policy advocacy as well. We are also incredibly fortunate to have within our program an amazing government relations team and offices both at the Boston Medical Center and at the Boston Children's Hospital. And they have been so helpful for our residents in terms of helping us to identify legislative advocacy opportunities based on our interests as residents. And so this slide is kind of highlighting different facets and ways that we do this. So we do this through a kind of section of the group called Policy and Pinot, which is a space for us to have kind of policy deep dive discussions. We have had events focused on how to identify and communicate with state representatives, how to strategize on our legislative priorities and advocacy interests. The community coalitions piece is a way for us to be involved in supporting grassroots initiatives and community-based advocacy or legislative advocacy initiatives. And the med ed component is, I think, also really special in that the policy think tank group has been involved in developing and kind of shaping some of the advocacy curriculum as well, and providing some additional like education and support for a lot of our residents who are involved in like legislative advocacy. And I know it's been mentioned multiple times already in this call that residents go to the State House and talk to legislators in so many different capacities. And so Policy Think Tank is kind of there to help residents and support residents in kind of preparing for those opportunities. And then finally, the advocacy alerts component of Policy Think Tank is really born out of recognizing as well that in the busyness of residency, there's so many of us who want to stay up to date and informed on policy issues that impact our patient population, but sometimes it can be hard to feel like you're constantly up to date on what's happening on these important issues. And so we partner with the government relations offices to help residents in our program kind of stay up to date with alerts that are integrated in our noon conferences. And you can advance the slide, please. And these are just a couple of photos that kind of show Policy Think Tank in action within the last year. So the first photo is a group of residents in our Policy and Pinot, one of our Policy and Pinot events, in which we had some of the faculty who are on this call tonight present, along with our government relations office reps, basically to chat with us about strategizing our legislative priorities ahead of last year. And then the second photo is highlighting one of the advocacy alerts that ended up kind of being I would say like a big initiative in our program for advocacy at the state level, which was to expand mass health to cover all kids, regardless of their immigration status in the state. And then the third is kind of highlighting, so this was a couple of residents in the program who went to the State House to speak with legislators about the mass health expansion, Cover All Kids. And in preparation for that event, Policy Think Tank helped to facilitate space for us to have kind of mock discussion with legislators to work on like story banking and kind of thinking about communication strategies leading up to that event so that we could, kind of be more effective in our advocacy efforts. So yeah, that's kind of, I think, highlighting some of the work that the group is doing. I'm happy to chat more or like answer questions about it. I'll leave my email too in the chat so that if you're interested or curious, you can kind of reach out.
Amazing. Thank you so much, LaShonda, for taking us through all of the incredible work that the Policy Think Tank is doing. Next, I'd like to pass the baton to Dr. Maggie McGeen, who's also a second-year resident and a rising chief. So we'll be co-chiefs with LaShonda, not next year, but the following one. So take it away.
Thanks, Hannah. I hope y'all are enjoying this. I remember coming to this as an applicant and it being like the thing that made me want to come to BCRP. So I'm happy to be here on the other side of things and still fun to hear what other people are doing in the program. So I just wanted to talk about health equity rounds. It's been mentioned a couple times, and we have some of our awesome faculty mentors on the call. These are some of the recurrent objectives that we have for our grand round sessions. They're case-based conferences. They happen quarterly, and they're entirely resident-led. So residents decide what topics we're doing. They prepare the presentation, and they give the presentation. We have often expert discussants involved or roundtables, and so it's a really great way to create really high quality and rigorous work, especially focused on the historical context and the present day role of structural racism and its impact on the healthcare system. And then we also get to learn and employ evidence-based tools like reflection, perspective taking, other things that really have a lot of evidence behind them to recognize and mitigate these implicit biases. And then we try to formulate solutions, whether it be policy based, advocacy based on an individual level as physicians. And so really an exciting way to kind of change how we're thinking about things. There's a few photos, I think if you click a couple. Yeah, so and I'll talk about this a little bit more in a moment too, but our faculty mentors especially are really helpful in pushing this not just at BMC and the BCRP, but more broadly. Dr. Shu, who's on the call, sort of started this, and now it's been disseminated. It's been published about it, and now is happening at a lot of institutions locally and all over the country. And there's a few photos of recent groups that did health equity rounds. This was one of the groups last year, and then this is a picnic that we had. So also just a really nice time to work alongside people outside of the clinical setting in a way that is a really nice way to share your passions with the program and with the institutions at large. Just as an example of some of the health equity rounds topics that we've done recently, this was the most recent one. I got to lead it with Dr. Kazanchi, another one of our awesome residents, and it featured one of our PEM fellows and then 3 residents, and we talked about what we call exploratory ingestions, especially focused around ingestions of cannabis, which we've been seeing more of in the emergency department and on the floor, and trying to imagine beyond, as our title says, this reflexive reporting to Child Protective Services and thinking about how we can protect children, but also not involve Child Protective Services or Department of Children and Families here in Massachusetts in cases where they're not the most helpful intervention. If you click again, we have a couple of other examples. This was the first health equity rounds of this academic year, and it was probably the most timely I've ever seen health equity rounds. They talked about the SNAP cuts, and I think the presentation was given 2 days before the SNAP cuts were made on a national level by the Trump administration. So it was just really helpful to both have some context and understanding of that, as well as think about solutions, both that we could have one-on-one with our patients in terms of food pantries that we could refer them to, and also more broadly about how we could advocate for our patients to make sure they have what they need. And then last example, this is from last year. This was one that was talking about shackling in the healthcare setting, and we had one of our hematologists as the speaker who had a very remarkable patient case related to this. And so again, all of these topics were selected by residents and prepared by residents, and then mentored by our awesome mentors like Mark Castera, Heather Shue, and AJ Mel, who are all on the call here. They also are really helpful in making sure that our work that we're putting into this is really well highlighted. So they help us put it on our CV. This is usually not people's driver for participating, but it is really helpful for a lot of us who are interested in pursuing health equity related careers, because we're able to really get credit in academic settings for the work that we're doing. So here's the information for the current leaders. Toby and I are both on the call, and then Rohan and Raquel are Med Peds colleagues. So we're happy to answer any questions. And then, like I mentioned, a lot of our faculty mentors are on here too.
Awesome. Thanks, Maggie. And next, we'll pass it off to Dr. Tovia Kopi, who's one of our triple board residents, to talk a little bit about our beloved Diversity Council.
Diversity Council is just one of the many things that make our program so special. It is yet another resident-led group that focuses really on highlighting the diverse aspects of each person in our program. We have a lot of different programming and a lot of different events that we tend to spend time on, but we also specifically have 4 arms of the Diversity Council, each of which is specially curated to how do I say, put a little special pizzazz into each thing that we do. So the 4 arms are the recruitment, community, social, and education arms. Recruitment is really focused on building that next class within the BCRP. And so we take a lot of pride in especially supporting the interest of those people with diverse identities who express interest in the BCRP. Some of the things that you guys might have experienced or will soon to experience are having specific buddies that you can connect with along the interview process, having points of contact or go-to people that you can communicate with throughout the interview season. We are very excited and we love our program deeply, but we're also very willing to talk to you guys about other programs and just managing the process as you go through. We also have the community arm, which is really focused on kind of like tiered things. So one thing that they used to do last year was partnering with a local elementary school to kind of do like a career day type of activity for the little kiddos there and showing them that they too could be doctors. And so a lot of the kiddos were in more marginalized areas within Boston. And so it was just like a inspiration, seeing people who look like you doing the things that one day you imagined to do was kind of the sense of that. But also community kind of tied with social helps us to foster our own sense of community within the program. So lots of fun parties. I mentioned it earlier, but we really take pride in how much fun we have here in our program. And so, work-life balance, we work hard and we also play hard. And so I think that just some of the events that the community and social arms of Diversity Council put on are very, very, very important for my personal mental health and my own happiness. And then the education arm similarly has partnered with local community organizations, but has also worked to develop some of our own curriculum within our program as it relates to celebrating and recognizing the diverse aspects of people within our program. So as of this year, we officially have 11 active affinity groups, which is something that we are very proud of and something that we celebrate like immensely because we've grown from a very small group to a very large one that covers a lot of diverse identities within our program. Diversity Council is open to all residents, regardless of your background, regardless of your personal identification as a diverse individual. Some of the affinity groups we have, can we actually go to the next slide? I just want to make sure. Okay, I'll talk about some of the affinity groups we have are like, I will shout out Black CRP because that's one I'm part of, but we also have BCR Pride, which you heard a little bit about earlier. We have Raices, which is our Latina group. We have Pagers and Prayers and Pagers, I think that's what it's called, which is like the Christian affinity group, Locks and Docs, and so many other groups that we have within our program. Part of the goal of Diversity Council as well is to increase representation of like specific house staff or residents who are coming from underrepresented groups within our program. We also have lots of mentors as part of Diversity Council, specific faculty mentors who help us to engage more in education and innovation, as well as helping us to get to national conferences, which hopefully some of you guys met some of us at national conferences over the last couple of years as we've been going and really lobbying and trying to get interest in our program. And then also helps us to become better leaders. It's just another way that this is like a formative process for us through the Diversity Council as it relates to medical education, healthcare, policy, child advocacy, research, and patient care. Okay, so I kind of spoke about some of these things, but more specifically, again, the community arm of the Diversity Council has partnered with a local elementary school. We've also partnered with a lot of the large. So for some reason, this might be a misconception, but Boston has a lot of minoritized individuals. And so for that reason, the city itself celebrates a lot of these diverse communities and a lot of these diverse groups. So one way they do that is by hosting block parties that kind of especially highlight and celebrate specific groups of people. And so we've been able to partner with some of the block party organizers to be able to celebrate certain identities. And then also another way was through kind of this theater partnership with LGBTQ plus youths in theaters. The recruitment arm. Oh yeah, great. Okay, cool. That's the gist anyways. I'll pass it on to the person.
Sorry, Toby, you did such a good explanation. I don't want to make you do it twice.
Oh, you're good. Thanks.
We'll always take more questions about DivCo, though we love talking about DivCo. It's so amazing. Lastly, I'll discuss very briefly our program for language equity, which is an amazing and ongoing effort that's at our Boston Children's Hospital specifically. So there had been some efforts in the past year, essentially, where we'd noticed that patients and families who speak languages other than English have higher rates of adverse events, such as hospital-acquired infections, readmissions, or other negative outcomes. And so there was this new effort called the Program for Language Equity that really was built around supporting patients who speak languages other than English to make sure that they're getting the support they need. One of the specific things that they'd wanted to focus on after some research and discussion with some of our amazing bilingual providers was the Med in Hands QI project. Which is working on both providing discharge instructions in language concordant care to make sure that patients are actually going home with paperwork that explains to them what happened in the hospital and their discharge instructions in a language that works for them and their family, as well as making sure that when they're leaving the hospital, they have their medications in hand, as one of the barriers we'd noticed was patients who speak languages other than English having a difficult time at discharge with the instructions on their medications not being in their preferred language, as well as actually getting to the pharmacy and picking up their medications either at their home pharmacy or the hospital pharmacy, depending on their language. And so we have started the amazing program for language equity and are doing some QI projects here with some iterative results that we're continuing to work on, which is really wonderful and exciting. And it's been like a multidisciplinary team effort from providers to nurses to different staff members, as well as the hospital pharmacy itself, to really get this in place for our patients, which is awesome to see. And something to say out loud that Boston Medical Center has had for a while of the medications in hand for our pediatric patients to make sure that when they're discharging from the hospital, we actually provide their medications to them at bedside, which is great. And I will pass it off to Chris to talk a little bit about funding.
Yes, thanks, Eleni. So I think you guys have heard about some absolutely remarkable advocacy work that our residents do, and it is hard enough to come up with the brilliant ideas to grind and sort of, lay the foundation for some of the work to sort of launch and get started. You don't need the barrier, right, of funding or sort of raising money to get in the way of that. And so I'm really happy and sort of proud to say that, again, as a part of multiple institutions across 2 large academic centers, we have lots and lots of funding opportunities to support, whether it's, a pilot that you're going to be implementing or a full-scale sort of trial of an intervention. We have the Alpert grant and the Lovejoy grant, as well as the Pell Free grant here at BMC that all of our residents are eligible to apply to, and that at least 5 or 6 of our residents and their teams earn funding up to about $5,000 for each of these grants twice a year. In addition, here at BMC, we have a Health Equity Accelerator, which is actually an institution-wide program that really is there to sponsor and support innovative new ideas that are centered on patient needs. And so, faculty and other staff are eligible for grants from Health Equity Accelerator, but our residents have gotten in on the action as well. A couple of our recent graduates, Kate Douglas and Miriam Fox, actually got money from the Health Equity Accelerator to fund a project they were doing to improve interpreter access in the PZD, and so purchased more iPads and ran an education intervention across all staff in the PEDS ED to improve access for our patients, as an example. LEAD mini grants are small, up to $500 grants that are available to our LEAD residents, but a lot of our categorical residents pair with our LEAD residents on a lot of these projects. And those have funded things like Maggie, for example, wanted to diversify the Reach Out and Read books that were available at her clinic site, and so applied for a LEAD mini grant and was granted that money. And then I'll end to say that BU has specific inclusion catalyst grants, which are sort of focused on a different topic related to inclusivity in medical education each year. And our residents and faculty are eligible to apply for those if they want to host an event, for example, that focuses on that particular topic for the year. These are just a smattering of examples. Our residents are also wildly successful in obtaining funding from external opportunities, such as through APPD or the New England Pediatric Program Directors Group, which offer funding. And our faculty, I think, are very, very good and well versed at coaching and mentoring our residents through identifying funding for their advocacy ideas. And with that, what I want to highlight now is really what the outcomes are of the advocacy work in our program. Our residents go on to incredible careers that are centered on advocacy. You heard a little bit about Lucy Marcel and her partner in crime, Mike Hull, two of our graduates who founded Street Cred, which is our innovative program that brought tax prep services to the clinic and built upon that to focus on financial literacy more broadly. That's now become a national organization across many different institutions. Megan Sandel is one of our vice presidents, or vice chairs, I should say, in the Department of Pediatrics at BMC. She was a part of directing Children's Health Watch, which is a really amazing organization that does at the bedside research on behalf of policy priorities related to child health. Jean Raphael, Alex Power Hayes, and Destiny Tolliver are all amazing health services researchers that focus on health equity, health disparities, and you've already gotten to meet Dr. Tolliver earlier today. AJ, you've also gotten to meet our inaugural Health Equity Fellow at Boston Medical Center and the director of our lead curriculum. Robin Reisberg founded the Boston Community Pediatrics, which is a primary care medical home founded on the principle that every patient deserves what a typical private practice offers in primary care, and has built incredible community partnerships in order to deliver on that dream. Just a few blocks from Boston Medical Center, and actually other BCRP graduates and alums are the other pediatricians in that clinic. It's really redefining what it means to provide exceptional primary care in a medical home. Sarah Myers was the director of immunizations at the CDC, and Jasmine Jackson partnered with AJ to, similar to Maggie, actually focus on the importance of diversification of literacy options in programs like Reach Out and Read, and is doing amazing things now in Michigan. Go Blue. So I just wanted to highlight all the various ways that you can become an advocacy leader, and I think the proof is hopefully here in front of you that that through these amazing connections and activities and collaborations that you can build in our program, you too can continue your trajectories as leaders in advocacy long term.
Alrighty, guys. Chris, thank you so much for wrapping up and kind of showing where, the fruits of all this labor can lead you in your career. So with that, guys, we will skip the breakout Q&A so we can respect all of you guys' time and just say thank you for joining. To all the faculty, we love you guys. Thank you so much for dedicating your time tonight to share with all of our amazing applicants, all the amazing work happening between both institutions. Thank you, applicants, for sticking with us for an hour and a half. I hope you guys are feeling just as inspired as I am at the end of this talk. I know it stinks that we didn't get to the Q&A, so if anybody has any questions or has a desire to get connected with anybody on this call or beyond, the Rising Chiefs will stay on to answer any questions that you guys have. And yeah, don't forget to follow us on social media so you can see us continue to support all the advocacy work happening at the BCRP. We are huge fans of hyping each other up, especially on social media when people are doing amazing work. So tune in. More to come.
Thank you.
Thank you.